I feel that well, I would just say hands down, the most pressing health equity issue is the cost of healthcare. It is the number one cause of bankruptcy for individuals and families. It's causing people to delay healthcare. It's causing people to avoid healthcare altogether. And by avoiding these routine checkups, that leads to chronic conditions. To avoid healthcare for acute condition that needs treatment can lead to worse health outcomes. So the cost of healthcare is significantly impacting how health equity is playing out across the country. Well, we can spend a lot of time unpacking all the factors that contribute to health equity. And I think there's a lot more that just goes beyond our roles as healthcare providers, healthcare workers within the healthcare system. If we understand how structural issues outside of the hospital impact the health of our patients, then we can see that there are a number of things that impact health equity. So if we understand that health equity is about individuals having a fair chance to attain their highest level of health, and that health literacy is being able to understand the information and get the information and put it to use, you can see how those two are interlinked. Because let's say, for example, I, as your doctor, give you a list of instructions for follow-up. If you can't make use of that information, then your health may be compromised. Pharma plays a huge role. There's a lot of discussion last year about diversity in clinical trials for pharmaceuticals. There's about how people can have access to medications that can treat their conditions. I think about my aunt who had a treatable condition. It was heart failure, but she could not afford the latest medications. So she had a very complicated regimen. And in the end, she could not keep up with it. And she died of heart failure, which was treatable. So pharma plays a role in equity when it comes to getting these medications to folks that need them most. And I think a last example would be just the presence of pharmacy deserts, which is, you see many areas that do not have access to pharmacies, and that relates to the structural issues that impact health equity across the country. So when we describe the most pressing issue for healthcare workers, I think it's just an understanding that what we do is just such a small part of what it means to keep people healthy. And if you understand that we are part of that chain and that there are things beyond our control, which we should have an understanding of, then that is something that we within healthcare can be a part of the solution. Now, it's not all hopeless. It's just understanding that it's very complex. It involves many other issues beyond our control, and that we in healthcare are not the answer, but part of the bigger solution. I think it's very important that we recognize how structural racism fuels health inequity and healthcare inequity. This is not a subject from which we should be afraid to approach, but it is a difficult concept to discuss sometimes, and many may not understand it or agree that it even exists. But if we recognize that racism is embedded in so many structures, it's in our education, policymakers, and within healthcare, then we can understand the past, how we got to where we are now. A study came out today in the New York Times that talked about how the maternal health of Black women and babies is much worse than white women and babies, no matter their income or education. That is an issue of race that's embedded within our system that we need to address. That's just one example. So if we truly care about the country, if we truly care about the healthcare of everyone, then we need to address how racism impacts us all. I feel confident that there is a movement within healthcare to better educate those of us that work in this profession. And I'd say it's not just for doctors and nurses. This applies to pharmacists, as you mentioned, pharmaceutical companies. This applies to all the different therapists. Anybody that has contact with patients and families need to be better educated about the structural issues that lead to health equity. When I think about my education in medical school, we discussed none of this, right? This was 25 years ago. It wasn't part of our curriculum, but it should have been, and it needs to be now. And I'm confident that we recognize that these are important issues to discuss during training. It's not just about diseases and treatments and surgical procedures. It is about the totality of things that impact our patients' health and understanding how outside factors can negatively impair their health outcomes. And as providers, being educated about that at the very early parts of our career, not later as I'm getting it now, but the early parts of our career will make us better providers for the future.